Good afternoon. I have the privilege again of speaking to Walter from Wildmedix in Cape Town. Walter is at the moment in Johannesburg, busy with training for the week, and he made time specifically to speak with me today. And we will be talking specifically about first aid training. Walter, welcome and good afternoon.
Hello, Rian. Thanks for having me again and good to see you.
I think let's just kick off and get going. What are the most common emergencies among civilians in South Africa specifically? And how can basic first aid training help?
Yeah, Rian, I think I don't really know 100% what the statistics would be on this, but
Sure.
I think in civilians very often deal with trauma-style emergencies, where there are injuries involved. To an extent, obviously with medical emergencies as well, but often that ends up being transporting a patient to hospital or, holding somebody's hand until the ambulance arrives, that sort of thing. There are exceptions, where civilians would need to do something a bit more with a medical emergency. But trauma emergencies, it's often your most pressing thing, and it's often the case where you require a civilian first aider's help the most to actually influence the outcomes. So I would certainly say in my experience, civilians at trauma scenes is quite common, and civilians rendering help in traumatic accidents and so forth it's fairly commonplace.
Okay. And so as a result, first aid training is a big bonus.
Yeah, absolutely. Look, if you look, both with medical and with trauma emergencies, if you look at statistics from countries that do keep good statistics, so the US is always very nice to look at statistics. They're pretty good at keeping stats. And the other interesting thing with US statistics is always that it's like 50 countries in one, basically. So each state has got its own rules and regulations and setup and so forth.
Yes.
And if you look at the ones where first aid training is a high priority, or where first aid training is enforced in high school, and in some of the states it is, I'm not sure, obviously I'm not an expert on that, but in a number of the states it is enforced that you perform basic, or you attend a basic first aid training in your last 3 years of senior school, right? So in South African terms, that would be grade 10, grade 11, and grade 12. In some of the schools, they only do what is called basic life support. So that's essentially CPR, the use of oxygen and bag valve mask, and then the AED, that's the automated electronic defibrillator. Essentially the thing that shocks the people, and if you in movies you always see the guy shocking the person with 2 paddles because it looks cool, right, on ECG, but you get a automated version that's got these 2 stickers that you put on the patient, and it's essentially made for lay people to use and for basic life support providers. It's a brilliant machine, and anyway, so your basic life support course includes that, and generally also management of choking. And it's a short course. It's normally you can cover that in fairly decently in about 5 or 6 hours. You can do a decent course on that. And in some of the states that is enforced. And if you look, for instance, in those states at the CPR success rate, it is significantly higher than in places where it is not enforced, which you can directly bring back to the amount of trained first responders and then the amount of equipment available in the public domain. Something like a AED, for instance, in the South African context, it is available at some places. Big corporate offices often have them, shopping malls have them, and so on. But it's still not very common. Whereas in many of the US states, it's enforced that every government vehicle has one. So the garbage truck would have an AED on it. You know what I mean? That sort of thing. And the moment you have higher levels of training in the public, and you have higher levels of public access equipment, it makes an insane difference to the statistics on something like CPR outcomes, for instance. And the same thing can be applied to, say, stop the bleed training or schools
Yeah.
stop the bleed, and where stop the bleed kits are available, with tourniquets, wound packing equipment, and so forth in it. The more it's available and the more training there is, there's a clear difference in the outcome if you look at the stats.
Well, I mean, I think that's something that should be instituted everywhere, to be honest. It sounds like a perfect solution to me. So to come back to South Africa specifically, how does the high crime rate that we suffer under here impact the importance of first aid training, and very specifically in response to trauma-related injuries?
Yes, look, it's massive locally, the amount of trauma that you see. If you're, in my experience as a frontline medic, it's, trauma is by and large what you see and deal with. It is also, if you speak to colleagues in other countries and so forth, especially the ones who are not used to South Africa, they often tell you, oh, you're mad, you make this stuff up, there's no ways you did all of those calls in one shift or something like that. And then we say to them, no, that was a soft shift, it was quiet. So we only did so many, it's, the level of crime is high, and related to that is trauma. I think also, aside from crime, crime, but also look at, poverty is a big issue. And the more poverty you have, often the more crime you have, and the more frustrated people you have, et cetera, et cetera. So your levels of trauma, especially and violence, is a lot higher. I think also in the South African context is, we focus a lot on crime. We always talk about crime statistics. Something else that is quite common is reckless injuries, So there is a fairly strong culture of recklessness in South Africa. If you just look at, say, speeding, or how people drive, the condition of motor vehicles on the road. People see things like the speed limit, they see it as a suggestion rather than a law, and it's,
well, it's true.
And the amount of aggression that's often associated to it, if you think if you're driving in Europe and you indicate to go left, then the guy behind you will back up for you so that you have a nice space and you can go left. And in South Africa, if you indicate left, and the guy behind you try to speed up so that he can direct you to another part of the country, the same afternoon. So
we do things a little bit differently, unfortunately.
Unfortunately, that type of a culture of kind of recklessness is also higher, aside from the crime rate. So trauma emergencies is a big issue.
Okay, so if I reach a point for whatever reason that I need to decide I want to go and do a first aid course, what are the main sort of differences between a beginner course and a more advanced course? And what are the kind of things that I need to factor into my decision making with which would be best suited for me?
Okay, so there are lots of different courses available, and one needs to distinguish between, I think, the regulation compliance courses, so where you require a certificate because of workplace regulation, for instance. And then you have courses which are special activities specific courses, or lifestyle specific courses, you can call it. For instance, if you work in remote areas or in wilderness areas, your training need is a lot higher than, say, somebody who's doing a course purely because I'm forced to do this because I'm the office first aider, for compliance reasons.
Yes.
So in South Africa, a lot of people are familiar with what used to be called level 1, level 2, and level 3 first aid, which was the old Department of Labor namings for the course levels. Okay. Yeah. Those courses are essentially urbanized office and factory workplace courses, with the level 1 course being very, very bare bones minimum thing. And the level 3 was supposed to be a bit more of an advanced course for covering more situations, and then also for looking after the patient for a prolonged period or a longer period of time. I think people still think, though, that a urban level 3, for instance, is equivalent to something like a wilderness first responder, for instance, and that it is not by a long shot. It's chalk and cheese. So you have to pick something that suits your purpose, and also ask yourself, am I doing this purely to upskill myself, or am I doing this as a part of my CV for a career? That makes the choice also a bit different. So I think, for instance, if you work in a dangerous profession, obviously it would be sensible to do a higher level course. If you work in a profession where you look after other people or you instruct other people in something, having a higher level qualification would be, it would only be professional, let alone it might be legally required, because you also have to consider that. So I think to make a choice, a person has to look, almost do a little risk assessment of your life, and decide what are my risks. And similar to general preparedness, if you're prepping and you are gathering, cans of baked beans, you ask yourself, am I planning for 2 days where I need baked beans, or am I planning for Armageddon, and I need a truckload of baked beans and maybe a couple of cans of ammunition? What am I planning for? What am I prepping for? And what are my needs? So I think the bare minimum is to do something like stop the bleed and maybe a CPR workshop, or alternatively do a traditional, level 1, for lack of a better term. It's now called a basic emergency first aid responder or something, so it's quite a long title, but that's normally it's a 2 to 3 day course, and that gives you a good foundation. Okay, so that's a good course also for parents or new parents to take, and so on. And then see if you like it, if you have an interest in it, or if you have a need for higher training, you can go up to the other levels. As I said, there are certain places where there are compliance requirements, and then you have to do specific courses for that compliance requirement. Right? So maybe you are the office first aider, or you're a factory first aider, or you're a registered tourist guide, for instance. Then there's a legal requirement on you to be registered and have a first aid certification, and then you have to pick the level according to the risk profile, basically.
Okay. When it comes to first aid in South Africa specifically now, you look at things like the Good Samaritan protections and potential liabilities. So are there any ethical and legal considerations that one need to keep in mind when you do apply first aid to somebody? If you more specifically, if you're just a standard civilian, I suppose, but also in a more professional capacity.
Sure. So I think firstly, people need to understand that there's a difference between being a first aider and being a registered medic. Okay, it's two different things. So if you're a registered medic, so you're basic, intermediate, advanced life support, whatever, or you're a nursing sister or a doctor or whatever, physiotherapist, something like that, you get registered with a health professions council, or maybe like with a nursing council or something, and you have to be registered with that every year in order to practice. So that's a whole different set of laws and regulations and so forth that's got to do with that. For first aiders, you can do 50 first aid courses and you're still considered a lay person. You're still essentially considered a good Samaritan. You're not a professional person. Okay. There are certain things to keep in mind, like if your role is to be a first aider, for instance, so if you're a designated first aider at work, then you have a duty to care. Or if you're an adult and there's an injured child, you have a duty to care. Or if it's a situation where you are looking after somebody else, like a school teacher, or you're let's say you're a firearms instructor, like your lone operator guys, right? So when they're at work and they're looking after students, there is a duty of care on that person, right? So although they're not a career first aider, they need to be certified, they need to have the correct equipment with them, they need to know what they're doing, because there's an expectation that they can act in case of an emergency. right? So one has to distinguish these things. Then the Good Samaritan law, for instance, or the Good Samaritan Act, South Africa does not have that. Okay, that's a bit of a myth. That is something that comes out of textbooks. So people see that in the, for instance, in US textbooks or in British or European textbooks. So in different countries, they do have laws that are known like that. So in the US, mainly, there is a regulation or a law that's known as the Good Samaritan Act commonly. But basically, what it boils down to is that you have to act reasonably within the circumstances, and you have to act according to, what you've been trained. So in South Africa, if you ended up having to be judged for this, they would look at, were your actions reasonable, considering the situation, considering your level of training, considering your level of education, etc., etc. It's all about, was it reasonable? Okay, now maybe I should just say as a disclaimer, I'm not a legal advisor or an attorney, so maybe speak to your attorney about this before you believe me. But generally, it's about reasonableness. Okay, was it reasonable under the circumstances? And that obviously it's dictated by the bigger picture, not purely by I said so or you said so or this or that training course said so. Okay, it is, what is the big picture? I think to be reasonable in your actions, attending training, being formally certified as a first aider, keeping your first aid certification up to date, keeping your first aid kit, up to date and well stocked and so forth. It all helps you to explain reasonableness, right? And to be able to also act reasonably. Am I up to date with what I need to do? Did I learn my skills 50 years ago and I'm now outdated, or did I learn it 50 days ago and I have the latest knowledge? It helps a bit, yeah. So
that makes sense.
I think an important thing about it is what I always try and say to my classes is a lot of first aid courses, the people spend half the course trying to scare you off of doing something else, or trying to make you think that your only job is to call for the EMS and then hope the paramedic pitches up in time. And that is, of course, utter nonsense. You need to train people to take action and to do things to save lives.
Yeah.
The job is not to scare people off. The whole idea is to get people comfortable so that they're willing to help. So part of that is making people realistically understand the hazards. So if, legal threat or civil liability, that sort of thing, it is a hazard, then you need to understand it correctly, not have it amplified by somebody who thinks they understand the law, for instance, and so on. Understand also that there's essentially what is called the law of necessity. Okay, so maybe I will do something that is outside of my scope of training, but under the circumstances, it is absolutely necessary to do that. Okay, and that is quite important. You see, in my line of work where we do wilderness and remote medical work, it's not the same as a patient getting injured 5 minutes from the hospital. You're sitting in a situation where, the closest help is the first aider, and the next closest help may be 2 or 3 countries away, let alone, the next decent help or advanced help, you know what I mean? So now you're sitting in a situation where if I don't do this thing, this patient will die or they will become permanently disabled. So I'm going to attempt to do it. So you may do something that's, in that case, which is slightly outside of your scope of training. And the question always is, what I said to myself is, can I explain, if I have to stand there and explain this to anybody, whether it's a judge or whoever's asking the question, you say to them, listen, this is what I faced. This was the big picture, and this is what I did and why. And I think that's reasonable, and you should be able to quite safely act. I think saving a life, it's a priority over worrying too much about what the next person's going to say about it.
Okay, I like that. I know that, if you do specific courses, you have to redo them every couple of years keep yourself what's the word that I'm looking for? To keep your certificates up to date and ensure that you stay up to date. But just more from a point of a view of responsibility. How often should I repeat this type of training?
Yeah, that's a good question. It's one of those things that a lot of people often argue. So look, in South Africa, the norm is every 3 years. So if you look at the government regulation courses, they generally expire every 3 years. Most of your international courses, you look at renewal approximately every 2 years. So if you if you look at many of the US or European first aid courses, they generally expire every 2 years. Some of them offer the option of doing a refresher course. So you will do the course, and then on 2 years you will do a refresher, which then gets you another 2 years, and then on 4 years you will do the whole full course again, and so on. So the systems differ a little, but there isn't a absolute uniform standard on it. I would say that if I look at some of the mining companies that I work for, where I do training for, mainly for the exploration divisions, most of the companies who take health and safety very seriously, they train people every 2 years. Okay, and some of them actually train every 2 years, full course, and a refresher course every 1 year. So it's full course refresher all the time. And it shows you how seriously they take this. And this is especially when you're looking at guys who do remote work where they're alone away from other help. Okay. In other words, in exploration, for instance, you will find that a geologist may be completely on his own, or he may be working with 2 or 3 other guys in an incredibly remote location. And they need to be able to look after themselves. I think also as a trainer, so look, I started training in 2004, so it's like 21 years of this for me now, and it's more or less my full-time profession. But so I see people a lot. I often see students for many times. Some of the students, they elect to come every year and a half. Some come every 3 years. Some try and argue every 3 years that, they want to buy a certificate for another 3 years, that sort of thing. I'm not in favor of that. I'm pretty serious about, refresher training. And the reason for that is because you see how the knowledge deteriorates, and what I've seen also is with a lot of the people we train on public courses are professional adventure guides, right? And the ones who take their job seriously, they come more frequently. You will see that same person is more professional in his guiding, more professional in everything else. He just comes more frequently. He doesn't drag it out until the last minute and then moan and complain about he has to come again every 3 years. Yeah, he sees it as part of his job and part of his responsibility to do this, And that's the type of person I am training at. So I'm fortunate that I can do that. And it's much nicer to teach people like that, because it's people who want to learn, people who want to be there. It's not somebody who's forced there because the boss said so. And so, yeah, I enjoy that. But you can definitely see that people don't retain the knowledge. And it's, it's not up to the instructor necessarily. I think the better you instruct and the more practically you instruct, the longer people retain the knowledge. But shelf life on medical knowledge, if you're not using it, you're probably talking about actually 6 months to 12 months. So, and when people become very rusty, even if you're an experienced person, I would go through phases where I'll be 3 or 4 months where I'm just training and I haven't done road work, and then I'll go, oh, geez, I need to go see a patient, just to stay in it, and I've been doing that for a very long time, a lot longer than I've been training. And a lot of my colleagues say that to me as well. A guy says, I took a year off to be fun employed, and now I'm back, and now I'm rusty. I've got to shake that off again. So it isn't something that lasts you. And also the facts change. The protocols change. The best practice changes, and you've got to keep up to date with it. So that's really the reason for retraining. But in terms of regulation, if people have a question on regulation, the government regulation certificates in South Africa every 3 years. That's your date.
What workplace safety regulations and requirements exist in South Africa regarding first aid training, and how can businesses ensure compliance while they are busy improving the safety of their employees?
Yeah, that's a good question, Rian. There are slight differences between regulations depending on job and workplace, but in broad outlines, the way I understand it at the moment, if something hasn't changed, in a sort of an office workplace environment, in other words, in a fairly mellow, low risk environment, you're looking at having one first aider per 100 people employed.
Okay.
And in a factory type setting, or a little bit more dangerous type workplace environment, agriculture and so forth, one first aider for every 50, so 2 per 100, or part thereof, right? So if you have 10 people, you still need one first aider, or 2 people, you still need one first aider. I think what people just need to understand about this is you have to have that one first aider on duty all the time. Okay, so if you work shifts, or if maybe that guy is off sick or he's on leave or something like that, then he doesn't count, right? So you need to have one on duty at all times, on shift and available. So the best thing is to train a team of first aiders. Also, because
that makes sense.
Look, certain skills and interventions require a team of people. There are some things that you simply cannot do alone. If you look at something like, say, spinal immobilization, putting a person on a trauma board, on a scoop, on a stretcher, that sort of thing, you cannot do that alone. And yes, although you can do that with untrained colleagues, you need to be pretty comfortable in your skills to command a group of untrained people in an emergency situation. So it's generally best to have a group of trained first aiders, but the regulation doesn't specify that. Then the other thing to consider is that generally the specified level of training is that you must at least have a basic first aid qualification. So that is what was commonly known in South Africa as a level 1, right? So if you have a level 1 in your office, you are complying. Then based on your company's workplace risk assessment, you need to establish whether you require a higher trained person or not. So a higher trained person would be then a level 2, 3, or maybe a qualified medic. You might have to employ a qualified medic, so like a lot of places do that. Bigger companies and workplaces sometimes have they have a whole medical unit or a sick bay, or if you think about a mine, for instance, there may be paramedics on duty and a nursing sister, even a doctor, So based on your risk assessment, which is something you have to have for compliance reasons as well, so you're forced to have a risk assessment, your risk assessment might specify that you need a higher level of first aider, and then you need to comply with that in order to be compliant, right? So it's a bit of a bigger picture. It's not an easy answer. It's a little bit of a layered answer.
Yes.
Yeah.
Okay. I want to move on to community safety now. What role does first aid play in community safety initiatives, and how can individuals contribute to improving emergency responses in their neighborhood? Yeah,
look, there are lots of community groupings that do this, so often connected to sort of neighborhood watch groups. So certainly, I've trained quite a few neighborhood watch people in different parts of the country for in different levels of first aid. Then what you find is in some areas people form specifically community first aid responder groups. Close to where I stay, for instance, I stay on the sort of on the south coast, Claremont, Betty's Bay, that area. There's a very active community first aid group, for instance, and I've done a little bit of work for them or with them for training. They've got a fantastic lady there who runs it, and as an example, they just stand out. It's amazing to me to see the amount of calls that come through how busy they are. And these are essentially community first aiders. They're not paid to do this. They attend to things, they save lives. They buy time for the ambulance to arrive and so on. And in our community there's now an ambulance that's like a private ambulance service that's got a single base there now, but for many years there was nothing, for instance. And it's a big area, and it's actually quite close to Cape Town. So people are sometimes, they think, oh, well, you're close to the city, I'll just quickly get an ambulance from Somerset West, or I'll quickly get an ambulance from Hermanus, that sort of thing. And then it's not that quick the day you need it, or there's something else going on there, or it's called Friday night, the ambulances are busy. So, and suddenly there isn't anybody for you. So those community initiatives are quite important. Up here in Johannesburg, in Pretoria, I've trained a lot of neighborhood watch people in stop the bleed skills. And they make a difference, and I often get feedback. I must say, I enjoy getting feedback from students and to see the difference people make in communities. I think it's the way to go. Communities need to look after themselves. They need to take responsibility for themselves. Not only for first aid, obviously, but for safety in general, for security, and medical and first aid is a big part of it. I've also, being a specialist in remote and wilderness medicine, I've often gone and trained in small little towns where people will ask me to come and present training, often also to farming communities. But sometimes you'll come to a town and they'll say to you, there isn't a doctor here, there isn't a nurse here, or there was a doctor, but we found him dead at his desk 4 days ago, so we thought we better go get it first aid. It's that sort of thing. And because the doctor was 88 years old, how long can the guy stick around? And it's all these things.
And you can't just replace it.
Yeah, you can't. I think also something that people might find interesting as well as how many of the poorer communities take very good care of themselves in terms of organizing, first aiders, organizing responders. I've done some very advanced training courses. These things are very expensive courses. And the people that raise their own money, they pay for it. They don't ask for freebies. They get you in to come and do it, to train there, often at community centers and so on. And if you ask the people, they'll say to you, look, we can't get an ambulance here in time, or if it's, sometimes it's considered dangerous to come here, so the ambulances don't want to come here, so we look after our own people. And it's very often the poorer people who organize this stuff way better than the welfare people do. The welfare people tend to think, I'll throw money at this problem, and it doesn't work like that, and the poorer people know they don't have money to throw, but they also know that, if you're counting on Big Brother, it's not always the best place to count on, so they look after themselves. I love being part of it.
I can imagine. Well, they've learned this the hard way, obviously.
Exactly.
Well, when it comes to resources and organizations in South Africa for first aid training, are there any, I know I don't want to put you on the spot, but are there any that you would consider better options than others? And also, how can individuals or groups access high quality training?
Look, I think for basic first aid training, there are lots of companies who offer it. Obviously, I don't know all of them. There are so many who offer it. I think a little bit of homework and word of mouth is, a good thing. Ask around in your area. Look for registrations. Look for qualifications of the staff. That's also quite important. I think it's quite important to look at who is training me, almost more than the company sometimes. Is this somebody who is actually operational, somebody who has at least been operational for a long period of time, who has actual experience of patients, or is this somebody who purely got certification to run first aid courses because they jumped through the government's hoops? And myself, I'm not a big believer in the concept of a first aid instructor. For me, it's it's somebody who comes from experience, so a medic or a nurse or a doctor who then goes into first aid training, for instance. For me, that makes more sense. I think there are the big, well-known names that a lot of people know. You know, you've got your Red Cross and St. John's, and you have Netcare as an academy, I think, in some places. ER24 definitely has a first aid division. So some of these bigger companies, which are brands that people trust, they do basic training. If you want to go do your, you know, your mom and nanny course, there, those guys are there. There are also very good smaller businesses who are regional. You know, we've got one office or one place, and you know, there are plenty. There are also quite a lot of really small businesses, individual instructors who travel around and present courses, who are very good. And I think one has to look at maybe a little bit of credentials. So something like, you know, if I want to do a CPR course, you know, is it an American Heart Association registered person, or is it the South African Resus Council registered person? You know, if I want to do a tactical course, what am I learning? You know, is not just for medicine, but for other part as well. You know, what am I learning on my tactical courses? Is this hoo-ha nonsense? Is it, you know, some guy who imagines himself to be a Navy SEAL because he's got dark glasses, or is it a guy who's got actual credentials? And I think in that field, for instance, one has to be very cautious of the medical credentials. Often the shooting credentials or the tactical credentials is quite good, but the medical credentials is absolutely shocking. In my opinion, you don't want to go do a medical course with your local firearms instructor just because he's cool at the shooting range. Right? It's you want to have somebody got a foundation in that. If I look at wilderness medicine, for instance, you know, for probably 20 years we were the only people offering wilderness medicine training, and at the moment there are quite a few guys trying to do that, which is it's good. There's a lot of need. One or two people cannot get to it, but I think one has to look at the credentials once again. Make sure that the person actually has wilderness and remote credentials. Make sure there's an extra qualification or something, not just, oh, the guy worked on an ambulance for 20 years, so surely he must know wilderness work. Generally, that person doesn't. To be honest, there's a huge misconception that, for instance, all medics can do wilderness work. Most have zero knowledge of wilderness emergencies. Now, I know there's a crossover, you know, splinting a broken leg in the city and splinting a broken leg in the mountain. It's very much the same thing.
Sure.
If you have a splint with you, the day you don't have a splint with you and you have to make those splints off the land, suddenly it changes altogether, right?
Yes.
And it's type of thing. So, you know, does the person have experience of what he's teaching me, or is he purely regurgitating something he read in a book or something that he learned on another course, and he's now presenting it purely as a money maker, right? So it's the sort of questions I think one needs to ask. If it is for legal regulation purposes that you're doing the course, make sure that the legal compliance is fair, that the person in the company is appropriately registered, that you're going to get your correct certificate, etc., right? Because if that's a big consideration, then make sure those things are in place.
Okay, thank you. That makes sense. When it comes to a basic first aid course specifically, what essential skills and knowledge should be included in such a course that can help me prepare for all common medical emergencies?
Right, so
we'll talk about an advanced one just after that.
Yeah, so if you look at a basic course, you know, you want to put the foundation down. So if you look at typically what was in the level 1 or the basic first aider course, often CPR is the most emphasized thing, which is it's a little skewed. Bleeding control should probably be the primary skill that you learn. It is sometimes necessary to do a level 1 course and also a stop the bleed course separately, right? So that you get that extra knowledge, because often what is taught on the stop the bleed is not taught, especially on regulation basic courses, okay? In fact, sometimes the regulation courses, tends to say things which are stupid, like you shouldn't use a tourniquet, for instance, okay, or they make these weird claims, you know. Then I think that sometimes it's a little unbalanced. So if you there are a lot of providers that offer a basic first aid course where the stop the bleed is included in that. We do that as an example. I don't run the 1 day level 1 type nonsense. That is, it's asking for trouble, in my opinion. So our shortest courses are normally about 2.5 days. And aside from workshops, so like we have small workshops like stop the bleed or CPR, but so bleeding control would be in there. Then CPR, also CPR. Maybe up to the level of using a pocket mask rather than just a mouthpiece, and using an AED is quite important. A lot of courses still teach without the AED. I think that's, it's outdated. The course should include the use of automated external defibrillator. Choking is definitely a good one to include, and then also different age levels, right? So for CPR, for instance, it's a little different working on a baby, for instance, when working on a child or an adult. So a course that covers adult, child, and infant CPR is good. Adult, child, and infant choking is good. And then some medical emergencies. So being able to identify something like a heart attack, being able to identify a stroke, being able to deal with common medical things like diabetes and diabetic associated problems, being able to deal with asthma and asthma associated problems. Then other wounds, for instance, so wound cleaning, basic wound care, basic burn care, for instance, is quite important. Then, managing hazards is of course important, so that should be mentioned somewhere in the course. Generally right at the beginning, right? Make sure the scene is safe, how to deal with that, how to ensure scene safety. And then you can add on from there, you can build up, but that should be in a basic course, I think. I think also an important thing is, I've seen people make these strange statements like, nothing in a first aid course is life-saving, only stop the bleed is life-saving, for instance. That is utter nonsense, okay? If you look at dealing with choking, for instance, how is that not life-saving? Okay.
Exactly.
Being able to perform CPR and somebody requires CPR, how is that not life-saving? Or dealing with a diabetic, people, if you look at diabetes, for instance, and asthma, these are growing diseases, right? More and more people suffer with them. Diabetes specifically, there's a high incidence of it now. It's, and if you have a diabetic go into a coma due to low blood sugar, they can lose their life, but they can also become permanently disabled, for instance. Now, if you know how to do things about that, how to assist, how to give sugar, what can you use as a quick absorbing sugar, that is life-saving. Okay, so people shouldn't get stuck on the idea that only stop the bleed is life-saving. That's utter nonsense. It is the most important skill, sure. It is the first one you should learn, sure, but it's not the be-all and end-all of first aid.
Well, exactly. I mean, that to me, that makes no sense. Your explanation, on the other hand, certainly does. Well, when you're looking at more advanced courses, what would you say should typically be part of such an advanced course in order to make me more effective? And this is typically, where you're looking at your more sort of traumatic cases, I would imagine.
Yeah, not only trauma. Look, I think on your advanced courses, if you look at a topic list on a basic course and a topic list on an advanced course, there often isn't so many extra topics, but the depth of knowledge varies quite a lot. Right? So I always say to the wilderness first responder guys, for instance, like a wilderness first responder course, it should be 80 hours at minimum. Right? So you're looking at 9 solid full days of training. I always say to the guys, I don't want you to do things because I said so. I want you to do things because you understand why. Okay. And I want you to query me. If I'm training your course, you need to question the hell out of me and make sure that what I'm saying to you makes sense. Okay, if your instructor can't answer you, he needs to get another job. It's important that you can understand why, because if you're alone, you need to be able to look at that patient and say, this is what I expect next. And this is what's happening with this patient. This is what's happening inside this patient. You'll be surprised that sometimes you can put a slideshow up on a board, for instance, in a class, and you do anatomy and physiology, and people will look at this thing and they go, is that inside me? They have clue. And you're talking about, you ask the guy, how did you get to 45, not knowing that's inside you? But people are often very surprised about what goes on in their own bodies. And on an advanced course, it's important that you understand what's going on in your body and what's happening in your patient. Remember, also a big part of being a first aider, and this is often neglected, on courses where we often look at a scenario where I'm coming to save somebody, right? I'm healthy and I'm in one piece and I'm coming to save an injured guy. But now what if you're also injured? How do I look after myself? How do I get myself stabilized to the point that I can look after my family or after the other person who was now, the guy who crashed into, if I'm a good person, I'm going to help him as well. It's not, I'm not going to let him die now because he crashed my car. So
of course.
How do I stabilize myself, and how do I, how do I then look after somebody else? So, in order to help yourself, you need to know what's going on in your body. You need to know the stages of shock. You need to know what's going to happen to you. Okay. A lot of people have this, oh no, I don't go into shock. I'm a tough guy and I was in the army. It's got nothing to do with being a tough guy. It's a physiological response. You can be as tough as you want. You'll go into shock. If you're bleeding, you're going to go into shock. Whatever. If you're not oxygenating, you're going to go into shock. So it's important to have that understanding. And that's what the advanced course does for you. It gives you the understanding, and then it gives you the ability to look after people for a longer period of time. I always say to the folks, okay, so your level 1 course here, it's designed to look after a patient for 20 minutes while you wait for the medic, right? And then you say, okay, so let's look at the stats quickly for Cape Town. So then they'll say, I recently read that average call or average on-scene time for a medic in Cape Town is 22 minutes from time of call. Okay, now just also note time of call and time of incident is two different things. Okay, so from time of call. So if you're looking after the patient for that 22 minutes, you're already 2 minutes short on your level 1 course. So you're over universe 2 minutes, if you think about it that way. And look, 22 minutes is a good time. Okay, so I'm actually not being negative about Cape Town. It's a very good time. It's kind of a world city time for a developed city. It's not bad. Okay. But it puts it into perspective for your if you look at bleeding control, for instance, I've got a video that I often show to the people of a guy who gets shot in the leg. And it's about 60 seconds and this guy's dead after getting shot in the leg. And so how much time did you have to actually treat this guy, and then people say, no, 60 seconds. And you say, no, let's look at this thing quickly. Let's look at what's happening in this guy's body. Let's look at the stages of shock. And then you realize you had about 25 seconds to treat this guy. And do you have time to call? Oh, you're going to call a medic, in 25 seconds. I want to see that. You need to act.
That gives new meaning to gone in 60 seconds.
No, absolutely. Yeah. And so your advanced course puts you in a position where, or it should put you in a position where you can look after a person for a longer period of time. And then it should give you a deeper understanding also of things like medical emergencies. Medical emergencies are often harder to deal with because you're kind of working blind in a way. A guy says, oh, I don't feel well. Okay, now where do you start? Or I have chest pain. What does that mean? That's the start of an investigation. Right? And if you don't have some knowledge and some background, you're not going to get it figured out, and you're not going to get the right treatment in there. So also remember, for instance, especially in remote situations, We train the first aiders to work with paramedics or with doctors who might be on a phone call. Right? So let's say you're a geologist in the field and you're 4 hours hike away from the camp and you have an emergency. So you might be on a satellite phone with a camp paramedic and you need to give him vital signs and you need to tell him what is it that I'm seeing and what is happening to my patient to get the correct advice. And
Yes.
that guy in turn may be passing that message on. Maybe he's speaking to a specialist on the phone on the other side. He's speaking to a doctor in the UK or something at ICE or one of these companies and speaking to them and say, look, doctor, my first aider is telling me this. I'm thinking this. What are you thinking? And to be able to form that chain, you need a solid first aider on the ground with decent knowledge, decent capability. If you look at a skill like, say, taking a blood pressure, how do I measure a blood pressure? That's a hard skill to learn. First aiders battle with that. I was teaching that yesterday, for instance. It takes half a day to get better to people to understand that. And then, okay, now you can measure the blood pressure. Now let's interpret the blood pressure. It takes you another half a day, to get to the point where the guy really understands what it is that he's seeing now. What does it?
Yes.
And what's going to happen next? And when should it be up a warning light for me? You know what I mean? So that's kind of your advanced first aider.
Okay. Well, I think that summarizes it. This is the kind of thing that you can speak about for days.
Yeah,
but I think that's a pretty damn good summary, and that is it from me. Unless you have something else to add to that.
I think maybe we can conclude with saying that first aiders need to realize that they have the most important link in the chain of survival. If you look at like the American Heart Association, for instance, they like to draw this thing that they call the chain of survival. That I always think it's an Audi's badge, but anyway, it's like this little chain, and then the first, it's early recognition, early call for help, early CPR, early AED. Okay. You can add early bleeding control in there if you want. And then the last link is early professional care. So if you think about that, then all the first links in the chain, it's all lay people generally, or it's first responders of some sort. And that's the most important part, right? Without those links, you generally don't get to the professional care, especially in a critical emergency, right? So first aiders are super important people in the community, and they're super useful and needed in a community. They make the difference between not only life and death, but also the difference between recovery and permanent disability. And I think that is often also misunderstood. And if you think in a society where maybe the guy you save is the breadwinner for 10 or 15 people, you know what a big difference that save makes, in the economy, in the community, in the society, so yeah, it's a hell of an important job. It's a hell of an important skills to learn.
Okay. Well, thank you so much. If you've been watching up to this point and you find value in these videos, remember, click the like and subscribe button. Help us grow the channel so we can get this message out to more and more people. Well, thank you so much for your time, and you must have a good evening. Enjoy the rest of your week in Johannesburg.
Thanks, Ryan. I'll try my best. And thanks for having me.